Welcome to the Access Direct Care Agency Audit Tool Overview. The purpose of this training is to ensure the safety of members and the quality of care they are receiving. This material is designed for fee-for-service programs including American Indian Health Program, TRBHAs, and Tribal ALTCS. Definitions: Direct Care Services, Direct Care Worker, and Direct Care Worker Agency. Direct Care Services are services provided by a direct care worker and are collectively known as Direct Care Services. There are three types of services within ALTCS that are provided by direct care workers. These include Attendant Care, Personal Care, and Homemaker Services. Direct Care Services are only available to ALTCS members who reside in their own home. The number and frequency of authorized direct care services is assessed by the member's case manager with the member and/or family member, guardian, or representative in tandem with the completion of a cost-effectiveness study. Direct care worker agencies hire and/or contract, supervise and monitor, and control or define the responsibilities and tasks of the direct care worker, as well as establish the rate of reimbursement and/or wages for the direct care worker. Attendant care services are not limited to the boundaries of the member's home. As indicated in the service plan, the direct care worker under attendant care may accompany the member as necessary in order to meet his or her needs in a variety of settings, including but not limited to a physician's office, school setting, or the workplace. Direct care worker. A direct care worker who assists an elderly person or an individual with a disability with activities necessary to allow them to reside in their home. A direct care worker's purpose and important responsibilities are assist the elderly or individual with disabilities with activities of daily living that allows them to reside in their home, transports member to medical visits and monitors medication, prepares meals, and they must know the responsibilities and carry them out and ensure they are compliant with state and CMS guidelines. Direct Care Worker Agency. A direct care worker agency is an agency that registers with Access as a service provider of direct care services that include attendant care, personal care, or homemaker services. By registering with Access, the agency warrants that it has a workforce, employees or contractors, with the abilities, skills, and expertise and capacity to perform the services as specified in Access policy. The Direct Care Worker Agency responsibilities. Agencies shall register with Access and sign and attest to meeting the terms of the Access Provider Participation Agreement. Provider Records and Registration, Chapter 3 of the Fee-for-Service Billing Manual reads, per the PPA, providers must follow all Access guidelines, policies, and manuals, including but not limited to the following: the Access Medical Policy Manual, AMPM, the Access Fee-for-Service Provider Billing Manual, Access Claims Clues, and reporting guidelines. Agencies shall also ensure the basic testing, documentation, and training requirements for DCWs are satisfied, including those involving direct care services that are provided through the agency with choice. Direct care agencies shall integrate the use of the Access Direct Care Worker and Trainer Testing Records online database into day-to-day business practices. The online database is used as a tool to support the portability or transferability of the DCW or trainer test records from one employer to another employer. Family members. The following relatives of a member are defined as family members in the context of what family members may get paid to provide services to an Access member. Parents may provide attendant care services if the member is 18 years or older, or under limited circumstances for members under the age of 18 when approved by the Access Administration. Member-directed options. Member-directed options allows members to have more control over how certain services are provided. The options are not services, but rather define the way in which services are delivered. Member-directed options are available to ALTCS members who live in their own home. Member-directed options includes agencies with choice and self-directed attendant care and the Division of Developmental Disabilities Independent Provider Network. Member benefits. Some benefits members will have are comfortable and positive in-home experiences, receives personalized care by a trained staff, social contact and meaningful connections, they look forward to visits, and have flexible care. Direct Care Service Agencies, monitoring and overview of the 6 standards of care. Direct Care Service Agencies access plans to conduct annual monitoring for Direct Care Service Agencies serving our Tribal ALTCS members who live in their homes. Monitoring will ensure the provision of service delivery in accordance with authorizations and the members' needs, quality of care for members, and training and supervision of direct care workers. Monitoring will be occurring at least once a year via desk level audit, and it will incorporate elements from AMPM Chapter 900 and 1200. Monitoring will be based on 6 direct care agency standards to be discussed in this training presentation. Standard 1, Supervisory and Monitoring Visits. The first standard is supervisory visits. Direct Care Agency shall perform periodic supervisory visits to ensure quality service provided by the direct care worker. Supervisory visits must be documented in the member's case file and cross-referenced in the DCW's personnel file. Supervisory visits. DCW agencies are required to perform periodic supervisory and/or monitoring visits to assess the DCW's performance to their assigned duties in the accordance with the member's individualized service needs. Supervisory and/or monitoring visits also apply when services are provided under the agency with choice option. Supervisory visits must be documented in 2 places: the member's case file and the direct care worker's personnel file. There are types of supervisory visits. 2 types of supervisory visits that need to be documented in both a member and DCW file are supervisory visits requiring the presence of the DCW and supervisory visits not requiring the presence of the DCW. Supervisory visits must be documented in both the member's case file and direct care worker personnel file. For additional information, please review AMPM 1240-A, Home and Community-Based Services, Section D. Exemptions. Certain certifications may qualify for an exemption: registered nurses, licensed practical nurses, certified nursing assistants, and anyone hired prior to 10/1/2012 who is still employed with the same employer. Quality of care documentation. Supervisory visits need to be documented. They need to be documented in the member's case file and cross-referenced into the DCW's personnel file. Direct care agencies review the quality of care concerns reported by the direct care agency supervisor and immediately report issues to the clinical quality management at Access. Direct care agency documents services such as fraud and abuse that were not provided as authorized. Direct Care Agency Supervisor reviews, discusses, and documents delivery of service with the member. Standard 2, Performance Evaluation of DCW. The Direct Care Agency ensures that the DCWA supervisory completes a performance evaluation of the DCW while DCW is present. The DCA must also ensure that supervisors follow supervisory visit timeframes. See Standard 3 for additional information on the timeframe. Standard 3, Timeframes and Supervisory Visits. The direct care agency must ensure that supervisors meet the timeframes and conduct supervisory visits that do not require the DCW's presence. The timing of these supervisory visits for the first 90 days is based on the date of the initial service provision and not the date of the initial service authorized. Supervisory visits requiring the presence of the DCW. A supervisory and/or monitoring visit is required once within the first 90 days of the DCW's initiation of service for each member served. These supervisory and/or monitoring visits are required to be completed annually, thereafter, or more frequent if warranted. Reminder, visits shall be documented in the member's case file and cross-referenced in the DCW's personnel and/or contract file. Supervisory visits not requiring the presence of the direct care worker. The purpose of these visits is to have a documented discussion with the member regarding the quality of care and ongoing communication with the agency to report instances where services are not reported or provided as authorized and other concerns. Tip: the timeframes for the supervisory visits are set. Here are some suggestions to stay within the timeframes. Scheduled visits, reminder call to the member, follow-up call to confirm appointment date and time. From the date of the initial service provision and for the next 90 days, supervisory visits are required by the 5th day, 30th day, and if issues are identified, 60th day, or 90th day from the initial service provision date. The 5th day visit shall not occur on the day of the initial service provision. The 30th, 60th, and 90th day visit must occur within 5 days of their due date. After the initial 90th day visit, all other visits occur at least every 90 days from the previous visit. The 90th day visit must not occur more than 5 days after its due date. Home health agency visits are in accordance with the Arizona Statute 9 AAC 10, Article 11. Here's an example of supervisory visits. John Smith receives a start of care visit from his DCW agency on January 1st, 2019. The agency must then follow up with the member and conduct a supervisory visit as follows. And the DCW does not have to be present at the member's home. By January 6th for the 5th day visit, another by January 30th for the 30th visit, then another by March 2nd only if identified issues are seen or reported for the 60th day visit, and by March 31st for the 90th day visit. After this subsequent 90th day supervisory visits should occur every 90 days. The next one would be due by June 29th, the 90th day from March 31st, but it could occur between June 24th, 5 days before, and July 4th, 5th day after. Here you will see a visit table example. The timeframe requirements for when these supervisory monitoring visits shall occur as indicated in the matrix above, including instances when the DCW must be present and when the DCW does not need to be present. The initial visit is required by the 5th day from the initial service provision and will not occur on the same day of the initial service provision. Visits occur at least every 90 days from the previous visit. Reminder, the initial service provision date is the date the service started. Standard 4, Training and Testing Period Standards. AHCCCS has established minimum competencies standards to ensure consistency in the quality of care for ALTCS members. A DCW, including those who are family members, may require additional training to meet the specific needs of the individual ALTCS member. Links to the test, curriculum, and other information can be located at www.ahccccs.gov/DCW. Demonstration of skills, knowledge, and abilities is required at levels for specified direct care workers. Completion of a training course is recommended. The demonstration of knowledge and skills by the test is mandatory. The direct care agency is responsible for ensuring compliance with the training and testing period standards. All documentation of testing and training must be in the DCW's personnel file. Per AMPM 1240-A, manage and maintain individuals' DCW training and test score records includes service provided by the DCW, exemption from training and testing requirements, hire, initial contract date, and date training period concluded, standard form utilized to obtain permission from DCW to access test records in the online database, verification of testing types, dates, modules, and scores. Verification source may include a completion, verification of direct care worker testing form, a former DCW agency available on the Access website, or official transcript from an approved direct care worker training and testing program. An annual timeframe, hours, topics, and delivery method for continuing education. Documentation to include in the direct care worker file. CPR certification. Certification must be obtained prior to providing care to an ALTCS member. First aid training documentation. Certification must be obtained prior to providing care to an ALTCS member. Continuing education units or courses taken. A minimum of 6 hours per year must be taken. Documentation regarding the educational topics must be kept. Documentation of method via video, in person, a written test, or conference. Also be documented in the direct care workers file. 3 references, 1 from a former employer, and the challenge test. Proof that the following courses have been taken or proof of exemption. Level 1, Introduction and Fundamentals of Caregiving. Documentation regarding which module was taken, the date taken, and the written test scores and skills test score must be in the direct care workers personnel file. Documentation of passing this course must occur within 90-day calendar days from the date of hire. Family caregivers providing direct care services to ALTCS members are also required to complete Level 1. Proof that the following courses have been taken or are exempt. Level 2, Aging and Physical Disability or Developmental Disabilities. Documentation regarding which module was taken, the date taken, and the written test score and skill test score must be in the DCW's personnel file. Documentation of passing this course must occur within 90 calendar days from the date of hire. Family caregivers providing services are excluded from Level 2. Certain certifications may qualify for an exemption. Registered nurses, licensed practical nurses, certified nursing assistant, and anyone hired prior to October 1st, 2012 who is still employed with the same employer. Standard 5, Continuing Education. The direct care agency is responsible for ensuring that DCWs have 6 hours of continued education as required annually. Continued education shall include training on additional curriculum modules and relevant topics, principles of caregiving, Alzheimer's disease and other dementias, modules developed by representatives of residential care, home and community-based care, experts in the fields of communication and behavior. The same topics cannot be repeated year after year. Family members in all DCWs shall comply with this standard and hold a CPR and first aid certification. It must be obtained in advance in order to provide care to an ALTCS member. It is required to demonstrate learned skills such as mouth-to-mouth and chest compression. Training shall be provided or sponsored by a nationally recognized organization. Web-based training without the benefit of an on-site demonstration of skills will not be accepted. In-person training is required. Continuing education. A mandatory 6 hours of continuing education must be completed annually. CPR and first aid training cannot be counted towards the 6-hour requirement. The yearly timeframe for continuing education for DCWs hired and/or contracted on or after October 1st, 2012 is the anniversary date of the DCW's date of hire. Same topics are not to be repeated year after year. For DCWs hired and/or contracted prior to October 1st, 2012, the yearly time frame for continuing education is from October through September. Verification of testing types, dates, modules, and scores must be documented. The documentation can be retained in either an electronic or hard copy filing system. As a reminder, a minimum of 6 hours per year must be taken for continuing education courses, documentation regarding the educational topic, and documentation of the method. Standard 6, online database utilization. The Direct Care Agency shall integrate the use of the Access DCW and Trainer Test Score Records online database into day-to-day business practices. The primary purpose of the online database is to serve as a tool to support the portability or transferability of DCWs or trainer testing records from one employer to another. Quality of care documentation. Supervisory visits. All visits must be documented in the member's case file and the direct care worker's personnel file. Documentation can be retained in either an electronic or hard copy filing system. Backup documentation shall be retained for a minimum period of 10 years per the Access Medical Policy Section 1240D, Home and Community-Based Services. Direct care agencies will report to Access Administration when services were not provided as authorized, the reasons for the services not provided, and document the determination through supervisory visits in the member's care file. Direct care agencies review quality of care concerns, report direct care agency supervisor, and immediately report issues to the clinical quality management at Access. Direct care agencies document services that were not provided as authorized, such as fraud and abuse. Direct care agency supervisor reviews, discusses, and documents delivery of service with members. Direct care agency supervisors review and discuss and document the quality of care with members. DFSM Provider Education and Training Unit. The DFSM Provider and Education Training Unit can assist providers with the following: how to submit and status claims or prior authorization requests through the Access Online Provider Portal. This applies to fee-for-service programs, including American Indian Health Program, TRBHAs, and Tribal ALTCS. How to status a claim and prior authorization request through the Access Online Provider Portal. Submission of documentation using the Transaction Insight Portal for daily trip reports and requested medical records. And additionally, the DFSM Education and Training Unit offers trainings with informational updates to program changes, system updates, and changes to the Access policy and Access guides and manuals. The DFSM Provider Education and Training Unit does not instruct providers on how to code or bill for particular services. For additional information on rates and coding, please follow the below guidelines. The coding team cannot instruct providers on how to code or bill for a particular service. Those questions should be directed to the provider's professional coder and/or biller. DFSM Provider and Education team can be reached at providertraining@azaccess.gov. Thank you for viewing today's training.